Imagine a time before anesthesia, a time when the very thought of surgery sent shivers down the spine. This wasn't science fiction, it was the harsh reality for most of human history. The concept of painless surgery was a distant dream. Surgery, even for simple procedures, was an agonizing ordeal. The screams of patients echoed through the halls, a testament to the unbearable pain they endured. Patients had no escape from the surgeon's knife. They were often held down by strong men or strapped to the table to prevent them from thrashing about. Ancient civilizations relied on crude methods to dull the pain. They used whatever they could find, from herbs to rudimentary tools. Alcohol, opium, and even blows to the head provided minimal relief. These methods were far from effective and often added to the trauma. These techniques barely scratched the surface of the pain. Patients were left to endure the excruciating agony with little to no respite. Surgery often resulted in shock, infection, and often death. The lack of proper sterilization and pain management made every procedure a gamble with life. The lack of anesthesia meant surgery was a last resort. People would rather suffer in silence than face the surgeon's table. People lived, and often died, with treatable conditions. The fear of the knife was greater than the fear of the ailment itself. The fear of surgery was very real and very present in everyone's minds. It was a time when the cure was often worse than the disease. The operating room, if you could call it that, was a gruesome scene. It was a place where the air was thick with the smell of blood and antiseptics were virtually non-existent. The walls echoed with the cries of patients who were about to undergo procedures that would test the limits of human endurance. Surgeons often worked in unhygienic conditions. The concept of sterilization was not yet understood, and the tools they used were rarely cleaned between procedures. This lack of hygiene led to a high rate of post-operative infections. Infection was a constant threat, adding another layer of danger to any procedure. Patients often faced a grim prognosis, not just from the surgery itself, but from the infections that followed. The mortality rate was alarmingly high. Surgical instruments were basic and brutal. They were designed more for functionality than for the comfort of the patient. These tools were rudimentary, often resembling the instruments of a butcher more than those of a healer. Saws, knives, and forceps were the tools of the trade. These instruments were used to cut through flesh and bone with little regard for the pain they caused. The surgeons had to be both skilled and swift. Speed was paramount. The faster the surgery, the less time the patient spent in agony, and the higher their chances of survival. Surgeons prided themselves on their ability to perform operations quickly, often in a matter of minutes. Wound closure relied on sutures, cauterization, and bandages. These methods were rudimentary, and often left the patient with significant scarring. The goal was to stop the bleeding and close the wound as quickly as possible. These methods were often painful and ineffective at preventing infection. Patients would endure excruciating pain during and after the procedure, with little hope of relief. The lack of proper pain relief made surgery a horrific experience. Without anesthesia, patients were fully conscious and acutely aware of every cut and stitch. The screams of agony were a common and haunting sound in these early operating rooms. Imagine the terror of being strapped down, fully conscious, as a surgeon cut into you. The cold steel of the surgical instruments, the dimly lit room, and the smell of antiseptic filling the air. This was the grim reality for patients before anesthesia. Surgeons had to work quickly, knowing that every second increased the patient's suffering. The pain was unimaginable, often leading to screams that echoed through hospitals and homes. These cries of agony were a common sound in surgical wards. Some patients fainted from the sheer agony, their bodies unable to cope with the intense pain. This was sometimes seen as a small mercy. Others endured, their cries a testament to the brutality of pre-anesthesia surgery. The surgeons, though skilled, could do little to alleviate the suffering. The psychological trauma was just as severe as the physical pain. Many patients were haunted by the memories of their surgeries for the rest of their lives. The ordeal didn't end with the surgery. Recovery was a long and arduous process, often filled with complications. Patients faced a long and painful recovery, often complicated by infection and sepsis. The lack of modern antibiotics made even minor infections potentially deadly. The experience left many physically and emotionally scarred. The visible scars were a constant reminder of the ordeal they had endured, while the emotional scars lingered, affecting their mental well-being for years to come. Despite the limitations, medical practitioners sought ways to alleviate suffering. Ancient cultures experimented with herbal remedies and rudimentary pain management techniques. Figures like Avicenna, a Persian physician, made significant contributions to surgical practices. His work, the Canon of Medicine, became a cornerstone of medical knowledge in the medieval era. While these innovations were crucial, they were far from the miracle solution that anesthesia provided. The search for a way to truly conquer pain continued for centuries.